Hello, NCLEX aspirants! Today's video is pure gold for anyone gearing up for their upcoming NCLEX exams. We've compiled a list of 120 questions that have been constantly repeated in previous NCLEX exams, appearing 5 to 6 times within just the last 1 year. These questions have been collected based on feedback from thousands of students who have passed the NCLEX exam in the last year after enrolling in our online course. If you're interested, you can also join our online course, where you'll receive daily 2-hour live classes, recorded sessions, test series, mock tests, and more than 2,000 NCLEX-based questions. And for this month only, we're offering a massive 70% off the total course fee. To add a fun twist, we've embedded a contest within this video. By correctly answering in the comment box all 20 questions that pop up randomly throughout the video under the contest question banner, you stand a chance to win up to $500 directly deposited into your account. Or you can opt for free enrollment in our online courses. Every month, we randomly pick a winner, so watch this video till the end to catch all the randomly sprinkled questions. If you're searching for NCLEX exam preparation videos, hit that subscribe button. With over 500 upcoming videos and daily live classes, we're here to help you ace the NCLEX exam on your first attempt. Let's jump into the video. A patient is experiencing abdominal discomfort and watery stool leakage from their rectum should be aware that these symptoms could be indicative of A. Constipation, B. Diarrhea, C. Bowel incontinence, D. Fecal impaction. Option D is correct, because fecal impaction should be taken seriously, as it occurs when constipation persists, leading to a hardened stool that cannot be passed. What is the client's first step when learning the proper techniques to descend stairs using auxiliary crutches after being placed in a leg cast due to a fractured right tibia? A. Place both crutches on the first step. B. Place the left foot and right crutch on the first step. C. Place the right foot and the left crutch on the first step. D. Place the right foot on the first step. Option A is correct. When descending stairs with crutches, the proper technique involves first placing both crutches on the first step. Then, the affected lower extremity should be positioned followed by the unaffected lower extremity. Which of the following equipment options will assist a patient with a total hip replacement in performing activities of daily living, ADL? Select all that apply. A. Abduction pillow. B. High seat commode. C. Recliner. D. Spinal traction system. Option A and B are correct, because a high seat commode, which keeps the hip higher than the knee, and an abduction pillow, used to prevent hip abduction and potential prosthesis dislocation, are equipment options that assist with a patient's recovery from total hip replacement. Additionally, a recliner can be helpful in preventing excessive flexion, although it is not necessary for activities of daily living. A patient is admitted to the hospital with a burn injury and is in the process of recovery. The healthcare team wants to ensure the patient's nutrition supports healing. Considering the patient's condition, which meal option would be most suitable to promote healing for this individual? A. Chicken breast, oranges, kiwi, and milk. B. Pasta marinara, garlic bread, and peanut butter. C. Ginger ale and jelly sandwich, banana, and coffee. D. Pork chop, fried potatoes, and tea. Option A is correct, because to promote optimal wound healing, it is essential to provide the body with a meal rich in nutrition, particularly focusing on protein and vitamin C. These two components play vital roles in the body's healing process. Protein aids in tissue repair and regeneration, while vitamin C supports collagen synthesis and immune function. Which vitamin deficiencies is the child with cystic fibrosis at risk for? A. Biotin and folic acid. B. Vitamin C, B12, and K. C. Vitamin A, vitamin D, and vitamin E. D. Pantothenic acid and vitamin B2. Option C is right, because cystic fibrosis, CF, is a genetic disorder that primarily affects the lungs and digestive system. It can lead to difficulties in absorbing certain nutrients, including vitamins. In the case of CF, the malabsorption of fats can result in inadequate absorption of fat-soluble vitamins. Now it's time for a contest question. By answering all questions correctly, you can win between $500 to $1,000, or you can opt for free enrollment in our online classes. What is the normal blood serum level of calcium? Type your answer in the comment box below. A 65-year-old male patient with a diagnosis of myasthenia gravis has a nasogastric tube, NG, in place and suddenly experiences a cessation of drainage. Describe the appropriate initial action that a nurse should take to address this situation and ensure the proper functioning of the NG tube. A. Check tube placement. B. Clamp for 30 minutes. C. Retract NG tube 6 centimeters. D. Instill 40 milliliters of water via the NG tube. Option A is correct. It is crucial to prioritize the verification of the NG tube placement before proceeding with any other measures. It is essential to ensure that the tip of the tube is confirmed to be in the stomach before administering any substance or performing interventions. A patient undergoing chemotherapy is presenting with stomatitis. What supportive measures or interventions should the healthcare provider consider offering to the patient? A. Offering warm saline rinses 4 times daily. B. Providing instructions for vigorous oral care with a commercial mouthwash. C. Recommending the consumption of lots of ice chips between meals. D. Suggesting the inclusion of hot soups for each meal. Option A is right. To alleviate discomfort and reduce infection risk, warm saline rinses are recommended as a non-irritating approach to eliminate harmful bacteria. Consider the condition of a client who is experiencing chest pain rated at 8 on a 10-point visual analog scale, along with ST elevation in the inferior leads observed on the 12-lead electrocardiogram and elevated troponin levels. The primary focus for nursing management of this patient should be on prioritizing which of the following: A. Educate the client on prescribed medications and dietary recommendations. B. Assess daily weights and urine output. C. Implement measures to alleviate pain and reduce myocardial oxygen demand. D. Permit unrestricted visitation by family and friends. Option C is correct, because nursing management for a client with a myocardial infarction prioritizes pain management and reducing myocardial oxygen demand. Close monitoring of fluid status is essential. What is the most critical assessment for the nurse initiating the nitroglycerin drip in a client with chest pain? A. ST elevation is present on the electrocardiogram. B. Blood pressure is 90/48. C. Serum calcium is 10 milligrams per dl. D. Heart rate is 60. Option B is correct, because nitroglycerin, a vasodilator, is commonly used to alleviate chest pain. The presence of ST elevation indicates myocardial injury, making nitroglycerin potentially beneficial. However, the nurse should be cautious as the client's low blood pressure may be a concern and require close monitoring. It's also important to note that the client's calcium levels and heart rate are within the normal range. What should the nurse prioritize first when caring for a client diagnosed with an anterior myocardial infarction 2 days ago and identified with a systolic murmur at the apex during assessment? A. Evaluate heart sounds with the client leaning forward. B. Obtain a 12-lead cardiogram. C. Draw an arterial blood gas. D. Assess for changes in vital signs, for example, heart rate, blood pressure, and respirations. Option D is correct. Infarction of the papillary muscles is a potential complication of a myocardial infarction, MI, resulting in ineffective closure of the mitral valve during systole. This leads to mitral regurgitation, where blood flows backward into the left atrium, causing a murmur that is typically heard at the fifth intercostal space, left mid-clavicular line. Ready for another contest question? Remember, answer them all and you might just win big. What is the smallest bone in the human body? Drop your answer in the comments. What are the desired effects of intravenous morphine sulfate for a client with acute chest pain? Select all that apply. A. Alleviates anxiety and fear. B. Promotes a decrease in respiratory rate. C. Lowers blood pressure and heart rate. D. Prevents ventricular remodeling. E. Reduces myocardial oxygen consumption. Options A, C, and E are correct, because morphine sulfate serves as both an analgesic and sedative medication. It effectively reduces myocardial oxygen consumption, blood pressure, and heart rate. Additionally, morphine is known for its anxiolytic properties, alleviating feelings of anxiety and fear through its sedative effects and slowing of heart rate. It is important to note that while morphine can depress respirations, caution should be exercised to avoid hypoxia, particularly in the treatment of chest pain. What instruction should the nurse give to an older adult with chest pain and shortness of breath who has been prescribed with nitroglycerin tablets? A. Chew the tablet until it is dissolved. B. Put the tablet under the tongue until it is absorbed. C. Place the tablet between the cheek and gums until it disappears. D. Swallow the tablet with 100 milliliters of water. Option B is correct. In the case of a client experiencing symptoms of a myocardial infarction, the initial action is to prevent platelet formation and block prostaglandin synthesis. To address this, the client should place the nitroglycerin tablet under the tongue and allow it to be absorbed. It's important to note that nitroglycerin tablets are not effective if chewed, swallowed, or placed between the cheek and gums. The nurse has conducted a comprehensive assessment on a client who presents with a reduced cardiac output. Considering the client's condition, certain findings should be prioritized due to their critical nature. What criteria should be used to determine the findings deserving of the highest priority? A. Weight gain of 1,000 grams in 4 days, BP 120/85, and mild dyspnea with exercise. B. Urine output 10 milliliters over the last 2 hours, orthopnea, and confusion. C. SpO2 93 on 2 liters nasal cannula, respirations 18, and 1+ edema of lower extremities. D. BP 130/72, atrial fibrillation with HR78, and babasilar crackles. Option B is correct. Signs of decreased tissue perfusion, such as low urine output and confusion, should be considered as top priority indicators. These symptoms suggest inadequate blood flow to vital organs and require immediate attention to prevent further complications. Orthopnea, which is the difficulty in breathing while lying flat, is associated with left-sided heart failure, should be given significant attention as the next priority. It indicates the accumulation of fluid in the lungs and necessitates prompt evaluation and management. While crackles, edema, and weight gain are important to monitor, they can be assigned as a relatively low priority compared to the aforementioned symptoms. These signs may suggest fluid overload and heart failure, but they do not require immediate intervention unless they worsen or become severe. In the case of atrial fibrillation, although there is a loss of atrial kick, the stability of blood flow pressure and heart rate indicates a relatively stable condition. While it should not be ignored, addressing the other higher priority symptoms would take precedence in the immediate management. For the next question, here's a game-changing opportunity. Boost your knowledge. Access our exclusive NCLEX course with a 70% discount this month. Benefit from daily expert sessions, comprehensive video lectures, and intensive tests to ace your nursing journey. Earn on the side. Do you want to earn some passive income? Join our affiliate program. Sell our course and grab a 10% commission. With just 10 sales, you can earn more than thousands of dollars. Link is given in the description box. The nurse observes a client's heart rate decreasing from 68 to 48 BPM on the monitor. To determine the appropriate course of action, the nurse should first A. Measure the client's blood pressure to assess their cardiovascular status. B. Auscultate for any abnormal heart sounds. C. Prepare for the possibility of transcutaneous pacing. D. Administer atropine 0.5 mg IV push. Option A is correct. First, the nurse should assess the client's tolerance to the drop in heart rate by checking their blood pressure and level of consciousness. This evaluation will help determine the need for atropine. In cases of symptomatic bradycardia, atropine and transcutaneous pacing are potential interventions. Once the client is stable, further physical assessments can be conducted. When documenting the findings for a client admitted with a myocardial infarction and atrial fibrillation, the nurse auscultates the heart and notes an irregular heart rate along with an extra heart sound at the apex after the S2. This extra heart sound persists consistently throughout the respiratory cycle. The nurse should accurately document these findings in the client's medical record as follows. A. Irregular heart rate with signs of aortic regurgitation. B. Irregular heart rate with indications of mitral stenosis. C. Irregular heart rate with the presence of S3. D. Irregular heart rate with the presence of S4. The answer is C. Here's the rationale. An S3 heart sound occurs early in diastole as the mitral and tricuspid valves open and blood rushes into the ventricles. To distinguish an S3 from a physiologic S2 split, note that a split S2 occurs during inspiration, whereas an S3 remains constant throughout the respiratory cycle. The pitch of an S3 is softer, and it is best heard with the bell at the apex. It is considered one of the initial clinical findings in left ventricular failure. On the other hand, an S4 heart sound is heard in late diastole when atrial contraction pumps volume into a stiff, non-compliant ventricle. However, an S4 is not audible in a client with atrial fibrillation since there is no atrial contraction. Murmurs, on the other hand, are sounds generated by turbulent blood flow through an incompetent or stenotic valve. Here comes another contest question. Get them all right and grab your chance to win. What is the early sign of digoxin toxicity? Share your thoughts in the comments section. A 65-year-old female patient presents to the emergency department with severe, crushing chest pain that radiates to the shoulder and left arm. The initial diagnosis upon admission is acute myocardial infarction. The prescribed interventions for admission include administering oxygen via nasal cannula at a rate of 3 liters per minute, obtaining a CBC, performing a chest radiograph, conducting a 12-lead ECG, and administering 2 milligrams of morphine sulfate intravenously. The nurse should prioritize the following actions first. A. Perform a 12-lead electrocardiogram, ECG. B. Administer the prescribed dose of morphine. C. Collect the necessary blood samples for laboratory testing. D. Order a chest radiograph for the patient. Option B is correct, because considering the urgency of relieving the patient's crushing chest pain, the nurse's priority action should be to administer morphine sulfate promptly. When administering thrombolytic drugs to a client with myocardial infarction, MI, and premature ventricular contractions, the expected outcome of the drug is to A. Aid in clot dissolution. B. Facilitate adequate hydration. C. Mitigate the risk of kidney failure. D. Manage dysrhythmias. Option A is correct because thrombolytic drugs play a crucial role in the management of myocardial infarction by promptly initiating clot dissolution within the first 6 hours following the onset of symptoms. Before administering tissue plasminogen activator, or TPA, the nurse should assess the client for which of the following contraindications to receiving the medication. A. History of cerebral hemorrhage. B. History of heart failure. C. age over 65 years, D. cigarette smoking. Option A is correct, because a history of cerebral hemorrhage is considered a contraindication to the administration of TPA due to the potential risk of further increasing hemorrhage. However, it is important to note that age greater than 65 years, history of heart failure, and cigarette smoking are not contraindications for the administration of TPA. A client, 50 years old, arrives at the emergency department after driving himself. He has a history of hypertension and shares that his father passed away from a heart attack at age 60. The client presents with indigestion, and the nurse promptly connects him to an electrocardiogram monitor while administering oxygen at 2 liters per minute via nasal cannula. Which should be the nurse's immediate next step? A. Collect blood samples for laboratory studies. B. Request assistance from the physician. C. Insert 1 or 2 IV lines. D. Obtain a portable chest X-ray. Option C is correct, because advanced cardiac life support guidelines recommend the initiation of 1 or 2 IV lines in either or both antecubital spaces as a priority. While contacting the physician, obtaining a portable chest X-ray, and drawing blood for laboratory studies are important, they should be considered secondary to the immediate task of starting the IV line. What does the presence of crackles during lung auscultation typically signify? A. Accumulation of fluid in the alveoli. B. Airway narrowing. C. Bronchospasm. D. Cyanosis. Option A is correct here. Crackles are typically heard during lung auscultation when there is an accumulation of fluid in the alveoli. It is important to note that the presence of crackles does not necessarily indicate cyanosis, and wheezing sounds are commonly associated with bronchospasm and airway narrowing. Gear up for the next contest question! You're on your way to possibly winning some great prizes. What is the best site for intramuscular injection in an infant? Don't forget to type your answer below. A 60-year-old male client who's on the second day after hip surgery and has no cardiac history reports experiencing chest heaviness. What should be the initial nursing action in response to this situation? A. Notify the physician about the chest heaviness. B. Assess the onset, duration, severity, and any precipitating factors associated with the chest heaviness. C. Provide oxygen via nasal cannula if needed. D. Offer pain medication for the chest heaviness. Option B is correct here, because in this situation, further assessment is warranted before taking any immediate actions. It is important to gather additional data before proceeding. Initiating further inquiry about the onset, duration, location, severity, and precipitating factors of the chest heaviness will provide essential information to convey to the physician. The nurse is evaluating an elderly individual with a pacemaker who leads a sedentary lifestyle. The client complains of inability to engage in physically demanding activities. In light of this, the nurse should conduct additional assessment to identify which of the following conditions. A. Placement of the pacemaker. B. Irregular heart rhythms. C. Peripheral vascular occlusion. D. Left ventricular atrophy. Option D is correct here, because in older adults who lead a sedentary lifestyle and do not engage in regular exercise, the heart muscle can undergo atrophy. Lack of use or deconditioning can cause abnormal changes in the myocardium of older adults. Consequently, when faced with sudden emotional or physical stress, the left ventricle may struggle to meet the increased demands on the myocardial muscle. This can lead to conditions such as decreased cardiac output, cardiac hypertrophy, and heart failure, which are primarily a result of inactivity rather than the aging process. Irregular heartbeats are generally not associated with the sedentary lifestyle of older adults. Peripheral vascular occlusion or pacemaker placement should not affect the individual's ability to respond to stress. What are the primary effects of nitroglycerin tablets given sublingually in the initial treatment of a client with angina? A. Causing an increased myocardial oxygen demand. B. Improved conductivity in the myocardium. C. Vasodilation of peripheral vasculature. D. Antispasmodic effects on the pericardium. Option C is correct here, because nitroglycerin induces peripheral vasodilation, leading to a reduction in myocardial oxygen consumption and demand. Additionally, this vasodilation can enhance blood flow to ischemic regions of the heart through coronary arteries and collateral vessels. As a result, nitroglycerin effectively decreases myocardial oxygen demand. However, it does not exhibit any influence on pericardial spasticity or conductivity within the myocardium. What alternative measures can the nurse suggest to a client experiencing a throbbing headache when taking nitroglycerin for angina? A. The client should lie in a supine position to prevent the headache. B. Nitroglycerin should be avoided if the client is having this serious side effect. C. Taking the nitroglycerin with a few glasses of water will reduce the problem. D. Acetaminophen or ibuprofen can be taken for this common side effect. Option D is correct here, because nitroglycerin commonly causes headaches, which can be relieved with aspirin, acetaminophen, or ibuprofen. To ensure proper absorption, avoid drinking immediately after taking sublingual nitroglycerin. Also, avoid lying flat as it may increase blood flow to the head and worsen symptoms like shortness of breath. Consult a healthcare professional if headaches persist. For a client with angina taking nifedipine, what should the nurse teach the client to do? A. Inspect gums daily. B. Be cautious with the intake of green leafy vegetables. C. Monitor blood pressure regularly. D. Perform daily weight checks. Option A is correct here, because clients taking nifedipine should inspect the gums daily to monitor for gingival hyperplasia. This is an uncommon adverse effect, but one that requires monitoring and intervention if it occurs. The client taking nifedipine might be taught to monitor blood pressure, but more often than monthly. These clients would not generally need to perform daily weight checks or limit intake of green leafy vegetables. Here is the next contest question. To which antibiotic drug category does amikacin belong? What is the expected outcome of a client taking warfarin with chronic heart failure, atrial fibrillation, and a left ventricular ejection fraction of 15%? A. Prevent thrombus formation. B. Decrease circulatory overload. C. Regulate cardiac rhythm. D. Improve the myocardial workload. Option A is correct here, because warfarin is an anticoagulant prescribed for the treatment of atrial fibrillation and decreased left ventricular ejection fraction, less than 20%, to prevent the formation of thrombi and the release of emboli into the circulation. It is essential to manage heart failure with additional medications as required. However, it's important to note that Coumadin does not reduce circulatory load or improve myocardial workload. Additionally, it does not have a direct impact on cardiac rhythm. A client with a history of heart failure is taking furosemide, digoxin, and potassium chloride. They present with nausea, blurred vision, headache, weakness, and confusion. The ECG strip indicates a first-degree antiventricular block. The nurse should assess the client for signs of which of the following? A. Pulmonary edema. B. Digoxin toxicity. C. Hyperkalemia. D. Fluid deficit. Option B is correct here, because early signs of digoxin toxicity may manifest as anorexia, nausea, and vomiting. Visual disturbances like double or blurred vision, as well as seeing halos, may occur. Low serum potassium, or hypokalemia, can contribute to arrhythmias and enhance ectopic pacemaker activity, increasing the risk of digoxin toxicity. While vomiting can lead to fluid deficit, in this case it is likely related to the adverse effects of digoxin toxicity, Symptoms of pulmonary edema include dyspnea and coughing. Upon admission, which of the following should the nurse prioritize in their assessment for an older adult with a history of heart failure and pulmonary edema? A. Serum potassium level. B. Urine output. C. Blood pressure. D. Skin integrity. Here, option C is correct, because assessing blood pressure first is crucial since individuals with pulmonary edema often experience severe hypertension that requires immediate intervention. While skin breakdown may not be an immediate concern, it should be checked when the client is stable and a complete health history is obtained. Potassium levels are not the primary priority initially. Monitoring urine output becomes important after the client's condition stabilizes. Lasix is given intravenously to a patient with heart failure. When can the nurse expect to observe the intended outcome of this drug's administration? A. Around 2 to 4 hours. B. Within 5 to 10 minutes. C. Approximately 30 to 60 minutes. D. After 6 to 8 hours. Here, option B is correct, because after administering furosemide intravenously, diuresis typically initiates within approximately 5 minutes and reaches its maximum effect in about 30 minutes. The medication's impact lasts for about 2 to 4 hours. When furosemide is administered intramuscularly or orally, the drug's onset is slower, and its duration is longer compared to intravenous administration. The healthcare professional imparts knowledge to a patient who has heart failure about the suitable schedule for taking oral furosemide in the morning. The main objective of this guidance is to A. Assist in the elimination of any excess fluids accumulated during the night. B. Reduce the likelihood of sleep disturbances during nighttime hours, allowing for better rest and recovery. C. Maintaining proper electrolyte balance. D. Ensure a gradual and controlled absorption of the medication. Option B is correct. When administering diuretics in the morning, the client's daytime voiding frequency increases, reducing the need for frequent nighttime voiding. As a result, the client's sleep remains undisturbed. However, taking furosemide in the morning does not directly prevent electrolyte imbalances or slow down rapid drug absorption. It does, however, help in preventing the accumulation of excessive fluids during the night. Another contest question coming your way. Every correct answer increases your chances. The placenta is delivered in which stage of labor? Make sure to comment your answer. What are the signs indicating potential digoxin toxicity that the nurse should educate the client about? A. Development of a rash over the chest and back. B. Increased appetite. C. Experience of visual disturbances, such as perceived yellow spots. D. Increased blood pressure levels. Option C is correct here, because colored vision and seeing yellow spots are symptoms commonly associated with digoxin toxicity. Abdominal pain, anorexia, nausea, and vomiting are other frequent manifestations of digoxin toxicity. Additional signs of toxicity include arrhythmias, such as atrial fibrillation or brachycardia. However, a rash, increased appetite, and elevated blood pressure are not typically linked to digoxin toxicity. If the client's serum levels indicate the following, the nurse should carefully assess the client for potential digoxin toxicity. A. High glucose level. B. Low sodium level. C. Low potassium level. D. High calcium level. Option C is correct here. The rationale is a client with a low serum potassium level, hypokalemia, may be at a higher risk of digoxin toxicity. This is because potassium plays a role in inhibiting cardiac excitability, and a low potassium level can lead to increased cardiac excitability. On the other hand, serum levels of sodium, glucose, and calcium do not affect digoxin or contribute to digoxin toxicity. Therefore, it's essential for healthcare professionals to monitor potassium levels in patients taking digoxin to prevent potential toxicity. What is the primary action that should be given the first priority of care for a patient showing signs and symptoms suggestive of a coronary artery disease? A. Enhance myocardial oxygenation. B. Educate the patient about their symptoms. C. Administer sublingual medication. D. Decrease anxiety. Option A is correct here because enhancing myocardial oxygenation is the first priority when a patient exhibits signs or symptoms of cardiac compromise. Without adequate oxygenation, the myocardium can suffer damage. Sublingual nitroglycerin is used to treat acute angina, but it is not the first priority in this case. While educating the patient and addressing anxiety are important aspects of care, they do not take precedence when the patient's condition is compromised. Non-invasive treatment options for coronary artery disease include which of the following procedures? A. Coronary artery bypass surgery. B. Oral medication therapy. C. Cardiac catheterization. D. Percutaneous transluminal coronary angioplasty. Option B is correct here because oral medication therapy is a non-invasive medical treatment for coronary artery disease. Cardiac catheterization, on the other hand, is not a treatment itself, but a diagnostic tool used to assess the condition of the coronary arteries. Coronary artery bypass surgery and percutaneous transluminal coronary angioplasty are both invasive surgical treatments for coronary artery disease. What is the most frequently observed symptom in patients experiencing myocardial infarction, MI? A. Edema. B. Dyspnea. C. Palpitations. D. Chest pain. Option D is correct here because the most prevalent symptom of myocardial infarction, MI, is chest pain, which occurs due to inadequate oxygen supply to the heart. Dyspnea, difficulty in breathing, is the second most common symptom as the body's metabolic needs increase during an MI. Palpitations, irregular or rapid heartbeats may occur due to reduced cardiac output, leading to arrhythmias. Edema, swelling due to fluid retention, is a later sign of heart failure, often observed after an MI. Stay sharp. Here's the next contest question. Are you ready to win? Which blood group is known as the universal recipient? Let us know in the comments. Which of the following blood tests is most commonly used to assess a cardiac damage? A. Troponin I. B. Complete blood count, CBC. C. Lactate dehydrogenase. D. Creatine kinase, CK. Option A is correct here because troponin I levels rise rapidly and can be detected within 1 hour of cardiac damage involving myocardial injury. Troponin I is specific to the heart muscle, making it a valuable marker for cardiac damage. Complete blood count, CBC, is useful for assessing blood cell counts, while lactate dehydrogenase, LDH, is found in various body tissues and is not as specific for heart muscle damage. CK levels may rise due to skeletal muscle injury, and CK isoenzymes are required to differentiate cardiac injury. What is the primary purpose of administering morphine to a patient with MI? A. To decrease oxygen demand on the patient's heart. B. To sedate the patient. C. To decrease the patient's anxiety. D. To decrease the patient's pain. Option A is correct here, because the primary reason for administering morphine is to decrease myocardial oxygen demand, which is essential for the management of the MI. While morphine can also provide pain relief, reduce anxiety, and cause sedation, those are not the primary purposes for its use in this scenario. After coronary artery bypass surgery, what is the most effective measure the nurse can take to prevent wound infection while changing a client's dressing? A. Thoroughly clean the incisional area with an antiseptic. B. Dispose of soil dressings in a waterproof bag. C. Apply prepackaged sterile dressings to cover the incision. D. Adhere to rigorous hand-washing procedures. Option D is correct here. To reduce the risk of wound infections after medical procedures, several essential measures should be followed. These include thorough hand-washing, utilizing sterile prepackaged supplies and equipment, cleaning the incisional area meticulously with an antiseptic, and ensuring proper disposal of soil dressings. However, according to experts, meticulous hand-washing before and after changing dressings stands out as the single most effective measure in preventing wound infections. Moreover, this vigilant hand hygiene practice plays a crucial role in minimizing the occurrence of other hospital-acquired infections, like urinary tract and respiratory tract infections. After open-heart surgery, a client is experiencing excessive calcium excretion during the post-operative period. To help prevent complications associated with excessive calcium excretion, which measure should the nurse prioritize? A. Encourage an alkaline ash diet. B. Increase the intake of calcium-rich dairy products. C. Promote regular bowel movements to prevent constipation. D. Ensure an adequate fluid intake. Option D is correct here, because in immobilized clients, calcium may shift from the bones and accumulate in the extracellular fluid. When the kidneys filter a substantial amount of calcium, it can precipitate and lead to the formation of calculi. To prevent calculi formation, nurses should implement specific interventions. These interventions include 1. Encouraging a liberal fluid intake to enhance calcium solubility and prevent precipitation in the kidneys. 2. Providing a diet rich in acidic components to maintain an acidic urine pH, which increases the solubility of calcium and reduces the risk of calculi formation. 3. Ensuring regular bowel movements to prevent constipation. While not directly related to excessive calcium excretion, promoting bowel regularity can positively influence overall urinary health. 4. Advising to limit the consumption of calcium-rich foods, such as dairy products, which can help in preventing the development of renal calculi. By implementing these nursing interventions, the risk of calculi formation can be effectively minimized in immobilized patients. The nurse is providing education to a client who is receiving warfarin sodium. Which of the following statements is accurate? A. Protamine sulfate is used to reverse the effects of warfarin sodium. B. International Normalized Ratio, INR, is used to assess effectiveness. C. Warfarin sodium will facilitate clotting of the blood. D. Partial thromboblastin time values determine the dosage of warfarin sodium. Option B is correct here, because International Normalized Ratio, INR, is a crucial value used to assess the effectiveness of warfarin sodium therapy. It represents the prothrombin time ratio that would be obtained if the thromboplastin reagent from the World Health Organization were used for the plasma test. Nowadays, INR is the recommended method for monitoring the effectiveness of warfarin sodium. Typically, the target INR range for clients receiving warfarin sodium therapy is between 2 and 3. In the past, prothrombin time was utilized to evaluate the effectiveness of warfarin sodium, and it was maintained at 1.5 to 2.5 times the control value. It is important to note that the partial thromboplastin time is used to assess the effectiveness of heparin therapy, which is a different anticoagulant medication. In cases where warfarin sodium's anticoagulant effect needs to be reversed, fresh frozen plasma or vitamin K is used. On the other hand, protamine sulfate is the antidote for reversing the effects of heparin. Overall, warfarin sodium plays a vital role in preventing blood clots, making it an essential medication for certain medical conditions. Proper monitoring and management of INR levels are crucial to ensure the therapy's effectiveness and the client's safety. Keep the momentum! Contest question ahead! Dive into the contest and answer away! How many deciduous teeth does a human typically have? Share your answer in the comment section. After a client undergoes mitral valve replacement surgery, it is essential for the nurse to assess the client's comprehension of post-surgery activity restrictions before discharge. Which of the following activities should the client avoid until their 30 days after discharge? A. Lifting anything heavier than 10 pounds or 4.5 kilograms. B. Light housework. C. Showering. D. A program of gradually progressive walking. Option A is correct here, because cardiac surgical clients commonly undergo median sternotomy incisions, which typically require around 3 months to fully heal. To facilitate healing, it is crucial to observe certain measures, such as refraining from heavy lifting, engaging in muscle reconditioning exercises, and exercising caution while driving. Showering or bathing is permissible, provided the incision is well closed with no open areas or drainage. After discharge, activities should be gradually resumed in a controlled manner. After mitral valve replacement surgery, the client reports a clicking noise originating from the chest incision, and there is concern about the incision appearing to enlarge. The nurse's response should be based on understanding that the client might be encountering which of the following issues? A. Perceived change in body image causing anxiety. B. Impaired blood flow around the incision site. C. Insufficient understanding of the post-operative recovery process. D. Anxiety due to changes in overall health status. Option A is correct here, because after open-heart surgery, the client's expressed concerns might be driven by anxiety regarding the physical changes in their body. While the client could potentially experience anxiety related to altered health status or lack of knowledge regarding the postoperative course, the primary focus is on changes in body image. Altered tissue perfusion is not a specific concern for the client. Pharmacologic therapy for a diabetic female diagnosed with stage 2 hypertension, initially treated with furosemide and ramipril, now includes metoprolol. What is an expected therapeutic effect of this addition? A. Increased urinary output. B. Alleviated fatigue. C. Improved blood glucose levels. D. Reduced heart rate. Option D is correct here, because administration of a beta blocker results in several effects, including a reduction in heart rate, contractility, and afterload, ultimately leading to a decrease in blood pressure. Initially, the client may experience an increase in fatigue upon starting the beta blocker. However, it's important to note that the mechanism of action of beta blockers does not bring about improvements in blood sugar levels or urinary output. The nurse is educating a client with hypertension on the proper administration of atenolol. What instructions should the nurse provide to the client? A. Follow a sodium-restricted diet of 2 grams per day. B. Avoid abruptly discontinuing the medication. C. Monitor blood pressure annually. D. Decrease the medication if experiencing severe headaches. Option B is correct here, because atenolol is a beta-adrenergic antagonist prescribed for hypertension management. It's important not to abruptly stop this medication, as it can be dangerous and may worsen symptoms. Discontinuation should only occur under a physician's supervision. Blood pressure monitoring is required more frequently than just annually, especially for newly diagnosed and treated hypertension clients. Typically, a 2-gram sodium diet is not a standard recommendation for managing hypertension. After an older adult with a history of hypertension is admitted with a diagnosis of dehydration, the client's condition is complicated by increasing confusion and weakness. The client mentions taking 1 tablet of hydrochlorothiazide daily, but the prescription now calls for half a tablet. To provide appropriate care, the nurse should note what additional information to address the situation effectively. A. Increased GI activity. B. Reduced hepatic blood flow. C. Decreased drug half-life of the hydrochlorothiazide. D. Increased urinary elimination. Option B is correct here, Because as individuals age, there is a natural decline in hepatic blood flow, which leads to reduced drug metabolism. This age-related change results in a longer duration of drug presence in the body, leading to intensified drug effects. Additionally, in this case, the client has taken more medication than prescribed, further increasing the potential for heightened drug action. The slower gastrointestinal motility in older adults allows for greater drug absorption, contributing to prolonged drug presence. It is important to note that increased urinary elimination would actually facilitate higher drug clearance, rather than accumulation in the body. Next contest question is, what is the drug of choice for dengue fever? Type your answer in the comment box to be the winner of the contest. What intervention would be the most effective in assisting a client with hypertension in maintaining an exercise program? A. Customizing the exercise program according to the client's individual needs and abilities. B. Providing the client with a written exercise program for easy reference. C. Offering reassurance and encouragement to the client, instilling confidence in their ability to follow the exercise regimen. D. Explaining the exercise program to the client's spouse, involving them in the process and support. Option A is correct here, because research has consistently demonstrated that personalizing or customizing a health program to align with the client's lifestyle is a highly effective approach for inducing changes in health behaviors. While offering a written program, explaining it to the client's spouse, and providing reassurance can be supportive, they may not yield the same level of adherence as tailoring the program to the individual's specific needs and preferences. The nurse is helping a client who recognizes the importance of quitting smoking and is now creating a plan to assist the client in reaching this objective. What should be the initial step in the nursing intervention plan? A. Establish the client's daily smoking pattern. B. Discuss the impact of passive smoking on environmental pollution. C. Explain how smoking worsens high blood pressure. D. Review the adverse effects of smoking on the body. Option A is correct here. To initiate a plan aimed at reducing or stopping smoking, the first step involves assessing the client's individual daily smoking pattern and identifying activities associated with smoking. While educating the client about the health and environmental risks linked to smoking is crucial, it is important to note that this knowledge alone may not effectively drive changes in smoking behavior. Which pharmacological effect is associated with propranolol hydrochloride administration? A. Blocks beta-adrenergic stimulation and thus causes decreased heart rate, myocardial contractility, and conduction. B. Increases norepinephrine secretion and thus decreases blood pressure and heart rate. C. Is a potent arterial and venous vasodilator that reduces peripheral vascular resistance and lowers blood pressure. D. Is an angiotensin-converting enzyme inhibitor that reduces blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2. Option A is correct here, because propranolol functions as a beta-adrenergic blocking agent, and its effects comprise a reduction in heart rate, a decrease in myocardial contractility, and a slowing of conduction. Notably, propranolol does not elicit an increase in norepinephrine secretion, induce vasodilation, or inhibit the conversion of angiotensin 1 to angiotensin 2. What triggers pregnancy-related heartburn? A. Reflux of stomach materials. B. Rise in peristaltic action. C. Stomach pushed by the diaphragm. D. Less secretion of stomach acid. Here option A is correct because heartburn results from stomach content reflux into the lower esophagus, leading to a burning feeling. To mitigate heartburn while pregnant, one should steer clear of spicy dishes, opt for several small meals, and refrain from reclining post-eating. Typically, peristalsis reduces in the later pregnancy stages. The uterus displacing the stomach rather than the diaphragm can be a factor for heartburn. A rise in hydrochloric acid secretion, not a reduction, can also be a culprit during pregnancy. What is crucial to show a 5-year-old while explaining cardiac catheterization? A. Guardians. B. Similar age peers in procedure. C. Model of a heart. D. Inserted tube. Here, option A is correct. The key to effectively educating a 5-year-old child is ensuring family members are present for support. Tailoring information to a preschooler's comprehension level is vital. Utilizing a heart model and catheter during preoperative preparation can be beneficial. However, other family members might grasp the concept of the heart model and catheter more than the preschooler. Ready, set, contest question. Answer correctly and aim for the prize. If a registered nurse finds that the chest tube drainage system has been broken, what will be the first nursing action? Drop your thoughts below. How's the best way to feed a 10-month-old with a hip cast? A. Get a unique feeding table. B. Put the baby flat. C. Have one person hold and another feed. D. Elevate the baby's feet and rest the lower body on a cushion. Option A is right here. Because a specialized feeding table or adapted high chair works best for infants accustomed to sitting during meals. Lying the child flat poses an aspiration risk. Simply elevating the child's head isn't as effective since they're not familiar with eating in a lying position. There's no need for 2 individuals. Why is an advance directive necessary on hospital admission? A. Worries about extreme steps when passing away. B. Lets you communicate desires when decision-making is hindered. C. It replaces discussions with your doctor. D. In emergencies, your doctor takes charge. Here, the correct option is B. The rationale is patients are given an opportunity to create an advance directive to ensure their preferences are honored if they can't make decisions. In the US, it's mandatory to inquire about advance directives upon hospital admission. In Canada, the regulations differ by province. This directive doesn't replace a thorough conversation with the doctor. Concerns about extreme measures can be addressed separately, but patients should know the directive safeguards their autonomy. Should an asthma patient use a salmeterol inhaler for exercise-induced wheezing? A. It's for allergic rhinitis, not for asthma. B. Use 5 minutes before exercising to prevent wheezing. C. No, it's a maintenance drug, not a rescue inhaler. D. Yes, use immediately for these symptoms. Option C is right here. Because salmeterol is a beta-2 agonist used by asthma patients twice daily every 12 hours. In contrast, albuterol serves as the rescue inhaler for sudden bronchospasms. While salmeterol can prevent exercise-induced bronchospasms, it's recommended 30 to 60 minutes before physical activity. However, if someone is already on the twice-daily regimen, no additional doses should be taken before exercise. Salmeterol is primarily prescribed for asthma and bronchospasms resulting from chronic obstructive pulmonary disease. The nurse advised the parent on handling sibling arguments. How should the parent act to show they understood? A. Cancels lunch due to the argument. B. Tells them to stop and shake hands. C. Threatens punishment at home. D. Ignores the argument. Here, option D is correct, because it's ideal for the mother not to step in. Kids should navigate disagreements independently. Constant parental intervention prevents them from learning this skill. Disputes between siblings are a natural part of growing up. Using penalties, such as denying them lunch outings, isn't justified. A mother's upset and wants to take her dying child home from the hospital. What's the nurse's best response? A. It's tough, but not the right choice for the kid. B. Understanding your feelings, the medicine can aid. C. I must inform your doctor before that. D. What's the reason to leave now? Option D is correct. When dealing with a visibly distressed parent, understanding the root of their concern is crucial. Thus, inquiring why she wishes to leave with the child offers a glimpse into the issue. While a nurse doesn't have the authority to prevent a mother from leaving with her child, it's essential to inform the doctor of such decisions and to clarify the potential consequences of her actions. It is not suitable for the nurse to claim understanding through phrases like, "I know how you feel," or "I can imagine the difficulty," unless they've undergone a similar experience. Here we go with another contest question. Engage, answer, and win. What is the normal serum creatine level? Type your answer in the comments. After a vasectomy, when is it safe for a man to engage in unprotected sex? A. Upon verification of sperm sterilization. B. After 5 to 10 ejaculations. C. Right away due to instant sterilization. D. When there's no more scrotal pain and swelling. Option A is correct here. Because after vasectomy, sperm tests are conducted every 4 to 6 weeks. The man is only deemed sterile after receiving a sperm-free result. Sperm levels in the ejaculate decrease over time. It's vital to inform clients that conceiving is still possible shortly after the procedure. A client with persistent vomiting risks metabolic alkalosis. What should the nurse assess for? A. Irritability. B. Hyperventilation. C. Diarrhea. D. Cosmal breathing. Here, option A is correct. The rationale. A patient with metabolic alkalosis might show signs of irritability or feel anxious. Rapid breathing can indicate respiratory alkalosis. Both diarrhea and deep labored breathing are potential symptoms of metabolic acidosis. A patient's nasogastric tube drained 2 liters of fluid in 8 hours. What should the nurse monitor for? A. Low calcium. B. Low potassium. C. Excess magnesium. D. High sodium. Option B is correct. Because potassium loss often occurs from the gastrointestinal tract due to vomiting, diarrhea, or nasogastric suction, leading to hypokalemia. Excessive gastrointestinal fluid loss doesn't cause hypermagnesemia. Water loss, like in diabetes insipidus or osmotic diuresis, or high sodium intake can cause hypernatremia. Factors like chronic kidney failure, high phosphorus levels, and primary hypoparathyroidism typically lead to hypocalcemia. After 2 days of severe diarrhea, what should be checked by the nurse? A. Dry mouth. B. Mental disorientation. C. Muscle spasm issues. D. Arrhythmia. Option D is correct here. The rationale is symptoms of low potassium levels encompass irregular heartbeat, tiredness, weak muscles, slack muscle tone, reduced reflex actions, feelings of nausea, episodes of vomiting, and intestinal paralysis. Hypokalemia doesn't typically cause muscle spasms. Thirst often indicates elevated sodium levels. Mental disorientation is a sign of low sodium and low calcium levels. The surgical unit's nursing team notes that in pharmacy midazolam and vancomycin vials look similar, risking confusion. To ensure safety, which actions should they take? Select all that apply. A. Rearrange medications during off-peak hours. B. Work with the pharmacy to find a mutual storage solution. C. Let the pharmacy staff handle the drug repositioning. D. Ask the pharmacy to separate the drugs. E. Inform all staff of concerns and solutions. Here, options B, D, and E are correct. Alerting the pharmacy about nursing concerns should be the initial step. It's vital for the nursing staff to collaborate closely with the pharmacy to craft a mutually beneficial system. Ongoing communication with all nurses during the improvement phase is essential for the joint approval of both entities. Shifting the drug's location during an off shift can risk errors, given the structured placement in the medication system. Solely relying on the pharmacy's decisions omits crucial insights from the nursing side, a key bridge between medication and patient. Onwards with the next contest question. Knowledge can earn you rewards. In reviewing the ABG report of a patient, if the pH is 7.30 and the CO2 is 40 and bicarbonate is 18, what kind of acid-base imbalance is present? Comment your answer. A mother doubts her infant's auditory ability. What guidance should the nurse provide? A. Clapping 40 centimeters away can help gauge the baby's hearing. B. Many areas require hearing exams for babies. C. It's rare for newborns to have hearing problems. D. Infants' hearing improves after 6 weeks. Here, option B is correct. The rationale is the American Academy of Pediatrics, along with the American College of Obstetrics and Gynecology, advocate for hearing tests in all newborns. Presently, over 30 U.S. states and a majority of Canadian provinces have made the screening mandatory. Newborns gain hearing once the amniotic fluid clears from the ear canal. While auditory issues in newborns are infrequent, it's important to acknowledge the mother's apprehensions. Using clapping as a basic test is unsophisticated and inconsistent. If used, the clap should be no farther than 12 inches or 30 centimeters from the baby. 3 days post-pyloromyotomy, a 6-month-old is placed in an infant seat. What's the nurse's best action? A. Discuss pacifier restrictions. B. Shift the baby to the left side. C. Affirm the proper infant positioning. D. Advise returning the baby to the crib. Option C is correct. Because pyloromyotomy is a surgical procedure used to treat pyloric stenosis. After a pyloromyotomy, it's ideal to position the infant with an elevated head and slightly tilted to the right to aid gastric emptying. The parents have done this correctly. The child should lie on the right, not the left. In a crib, the infant's head can be raised and they can be supported on the right side. Which symptoms show a client moving to an advanced shock stage? A. Speaking unclearly. B. Being confused. C. Losing consciousness. D. Feeling restless. Option B is correct here. The rationale is, during the advanced stage of shock, a patient may show signs of fatigue, confusion, and delayed speech. The restlessness is observed in the earlier stage, while unclear speech and unconsciousness indicate a critical, non-reversible stage. What symptom shows head lice, pediculosis capitis, in students? A. An itchy scalp. B. Flaky skin areas. C. Blisters on the scalp. D. Bald patches. Option A is correct. Because frequent scalp scratching indicates pediculus capitis, or head lice, due to the intense itchiness it causes. Usually scratch marks are evident. Given how easily head lice spread, it's advisable to check the child's family and friends for the same. Conditions like spotty baldness, wheals, and scaly lesions are generally allergic reactions. While assessing a primogravid client at 8 weeks gestation, the nurse notes a purplish color to the vagina and cervix. The nurse documents this finding as which of the following? A. Hedger sign. B. Latin sign. C. Osiander's sign. D. Chadwick's sign. Option D is correct here, because the Chadwick sign is characterized by a distinct purplish-blue hue in the vagina and cervix, resulting from heightened blood supply to the vaginal region during pregnancy, making it a potential indicator of pregnancy. In the early stages of pregnancy, Osiander's sign can be observed, which refers to a unique pulsation in the vaginal fornices, a consequence of the increased blood circulation in that area. After the 6th week of gestation, Leyden's sign becomes noticeable, marked by a softening of the center of the uterus, specifically where it connects with the cervix. Furthermore, the Hedger sign, recognized as one of the early physical indicators of pregnancy, denotes a softening in the lower part of the uterus, typically discernible between the 4th and 6th weeks of gestation. Here's your next contest question. Rise to the challenge and comment below. Which blood group is known as the universal donor? Drop your answer. During an assessment, a nurse is evaluating a patient with a fractured right leg to ensure the correct technique for crutch use. Which of the following remarks from the patient suggests proper crutch use? A. I've added padding to my crutch's tops to make leaning on them more comfortable. B. When I move forward, I always step with my left leg before swinging forward on my crutches. C. When walking, I notice that most of the pressure is on the palms of my hands. D. After using my crutches, my arms tend to tingle. I guess I need to work on my arm strength. Here, the correct option is C. When using crutches, it's expected for the user to experience pressure on the palms of their hands. Ideally, the client should move the affected leg, in this case the right one, forward, synchronizing the movement with the swing of the crutches. It's important to note that leaning excessively on crutches can exert undue pressure on the axillae, potentially compromising neurovascular function. Tingling sensations in the arms after crutch use may indicate the client is inadvertently putting pressure on the axillae during ambulation. An 8-year-old with rheumatic fever displays polyarthritis, chorea, and heart tissue swelling. What's the best nursing action for the care of this child? A. Maintain a slightly cool environment. B. Inform that chorea is temporary and it will subside after some time. C. Give aspirin and encourage movement every 6 hours. D. Neurological assessments every 8 hours. Option B is right here. Here's the rationale. The family must understand that chorea from rheumatic fever is temporary. Nurses should reassure them about its eventual resolution. Routine neurological assessments aren't vital because chorea is non-progressing. Given the heart condition, physical activity is not recommended. Aspirin primarily combats inflammation, but also alleviates pain. Room temperature adjustments aren't necessary as they don't impact the child's symptoms. An unmarried college student at 8 weeks of pregnancy is considering an abortion. What's the typical procedure for this stage? A. Dilatation and vacuum extraction. B. Dilatation and curettage. C. Saline induction. D. Cycle-based extraction or menstrual extraction. Option A is correct here. For pregnancies under 13 weeks, dilatation and curettage is the typical method for elective abortion. Suction evacuation, also known as menstrual extraction, is preferred for those between 5 to 7 weeks. Between 12 to 16 weeks, dilatation and vacuum extraction is the go-to. For those between 16 to 24 weeks, a saline solution is introduced into the amniotic sac to prompt expulsion with saline induction. Oxytocin can also be used alongside saline induction. How can a nurse support parents facing their leukemia child's impending death? A. Losing a 10-year-old is tougher than a younger child's loss. B. Being aware of a grim outlook aids preparation. C. Families feel profound sorrow when a child initially shows improvement, but then deteriorates quickly. D. Early deaths often erode trust in medical teams. Here, option C is correct, because research indicates that parents feel deeper pain when hope turns into sorrow. When devising strategies to support parents of a terminally ill child, nurses should keep this in mind. Long-term knowledge of a grim prognosis doesn't always prepare parents for their child's passing. Moreover, it's not a given that untimely deaths break trust in health professionals, or that the loss of an older child is harder to bear than a younger one. Because mucositis results from radiation therapy, leading to oral mucosa inflammation. Meticulous mouth care, inclusive of flossing, is crucial for clients with mucositis to prevent infections. This care should be given before and after meals, at bedtime, and as required. Foods and drinks with extreme temperatures should be avoided. Using half-strength hydrogen peroxide on irritated tissues is too abrasive. A client with radiation therapy has mucositis. What should be included in their care plan? A. Providing hot tea. B. Using diluted hydrogen peroxide on ulcers. C. Promoting teeth flossing. D. Increasing mouth care frequency. Here, option C is right. Your next contest question. Give it your best shot. What is the most common side effect of the injection amikacin? Make sure to share your answer in the comment box below. During labor at 39 weeks with the fetal heart sound above the umbilicus at midline, which fetal position is likely? A. Frank breech. B. Transverse. C. Face. D. Cephalic. Here, option A is correct. Because in a breech position, the fetus's heart rate is usually found above the umbilicus due to the heart's position near the top of the mother's uterus. For a fetus in cephalic presentation, the heart sounds are generally detected either to the left or right side of the uterus, and given the heart's lower position, sounds are heard beneath the umbilicus. Similarly, with a face presentation, heart sounds are on the left or right side, and due to the heart's location in the uterus's lower part, they're also heard below the umbilicus. For a fetus in transverse lie, heart sounds are typically below the umbilicus and centrally positioned. A 40-year-old woman admitted for mastectomy seems anxious and has many questions. The best response by the nurse is to A. Inform the client based on her capacity to understand. B. Address her questions during the recovery phase. C. Answer her queries when her anxiety reduces. D. Advise her to consult her doctor for her concerns. Here, option A is correct. A crucial nursing task is preoperative education. The suggested approach is to inform the patient to the extent of their curiosity and comprehension. Postponing discussions can heighten the patient's anxiety. Advising the patient to consult their doctor can overlook their immediate concerns. Which side effect should a client taking dexamethasone and furosemide report? A. Increased thirst. B. Diarrhea. C. Muscle weakness. D. Excitability. Here, option C is correct. The rationale is, the nurse should advise the client on dexamethasone and furosemide to watch for hypokalemia symptoms like malaise, muscle weakness, vomiting, and paralytic ileus. Both drugs can lower serum potassium. This drug combo doesn't lead to excitability, diarrhea, or thirst. A mother says her 4-year-old is fussy during meals. What should the nurse advise? A. Provide structured meal routines. B. Allow the child to decide meal times. C. Give the child finger foods to eat anytime. D. Don't feed the child if he cries. Option A is correct here. Because each child possesses distinct temperaments and activity rates, requiring tailored parenting approaches. Children prone to agitation benefit from predictable settings, aiding in setting expectations. In contrast, laid-back children cope well with variable meal timings. Withholding food from a crying child neither supports nutrition nor instills proper eating habits. Highly active kids often prefer handheld foods and frequent meals. While assessing a multigravid client at 8 weeks gestation, the nurse notes a softening of the vaginal portion of the cervix. The nurse documents this finding as which of the following? A. Goodall's sign. B. Melasma. C. Osiander's sign. D. Chadwick's sign. Here, option A is correct. The rationale is Goodall's sign, which is defined by a distinct softening of the vaginal section of the cervix. This change, resulting from enhanced vascularization, becomes noticeable around the 8th week of gestation. Chadwick's sign, characterized by a purplish-blue hue of the vagina and cervix. This color shift arises from the increased blood supply to the vagina during pregnancy, marking it as a probable sign of pregnancy. Osiander's sign, referring to a unique pulsation felt in the vaginal fornices early in pregnancy, attributed to the augmented blood circulation in the region. Melasma, commonly known as the mask of pregnancy. This term describes the facial skin pigmentation seen in some pregnant individuals and stands as a presumptive sign of pregnancy. Next contest question is, what is the drug of choice for treating myasthenia gravis? Give your answer in the comment box. Here we go. The nurse spots a closed IV 50% dextrose in a unit bin. What's the next step? A. Make an incident note. B. Dispose in sharps bin. C. Alert risk control. D. Forward to the pharmacy. Here, option D is correct, because the nurse ought to forward the sealed IV 50% dextrose container discovered in the unit bin to the pharmacy. Given its potential lethal effects when misused, 50% dextrose shouldn't be kept outside the pharmacy. There's no need for an incident report here. Using a sharps container for its disposal isn't suitable. What are the risk factors for hepatitis C? A. Tattooed recently? B. Consumed impure water? C. Consumed shellfish? D. Trip to Sri Lanka? Option A is right here, because hepatitis C is transmitted via direct blood contact, like during tattooing. Hepatitis A can be contracted from impure water, being in developing nations, or consuming shellfish from polluted areas. For a client with substance abuse, what aids them best with feelings related to drugs? A. Recreation. B. Solitary activities. C. Group sessions. D. Individual therapy. Option C is right here, because individuals battling alcohol or drug addictions, group sessions prove instrumental in addressing emotions and apprehensions tied to their substance abuse. They find resonance in shared experiences within the group, fostering a mutual understanding and aid in navigating these emotions. The collective dynamic of the group enables mutual support and constructive feedback. While one-on-one therapy has its merits, it often lacks the peer reinforcement and timely interventions found in group settings. Engaging solely in solitary pursuits or recreational activities can inadvertently foster avoidance of core issues. Addressing these concerns directly is essential for holistic recovery, and group settings often provide the optimal environment for this growth. Which lab value to monitor for acute pancreatitis? A. Elevated calcium. B. Raised serum amylase and lipase. C. Diminished glucose. D. Reduced urine amylase.
Stand coast.
Here,
NClex
option
coaching.
B is right, because in pancreatitis, serum amylase, lipase, and urine amylase levels rise. Other notable changes include a drop in calcium and elevations in glucose and lipid levels. What should a nurse do for a creatinine clearance test? A. Hand over a clean urine container. B. Advise 24-hour urine collection. C. Recommend intake of 3,000 milliliters per day. D. Place a urethral catheter. Option B is correct here, because the creatinine clearance test, spanning 24 hours, assesses protein degradation in the body. Collection doesn't require a sterile vessel. If the client can manage urination, a urinary catheter isn't needed. Additionally, pushing fluid intake is unwarranted. After transurethral resection of the prostate, or TURP, a client has incontinence and drinks less. What should the nurse advise to the patient? A. Drinking less can lead to kidney stones. B. Consume 8 glasses daily and urinate every couple of hours. C. Should the incontinence persist, we may need to use the catheter again. D. Reducing your fluid intake might lessen the incontinence. Option B is correct here, because after a TURP procedure, it's essential for patients to maintain proper hydration, even if they're experiencing occasional dripping or incontinence. They should aim for at least 8 glasses of water daily. This not only dilutes the urine, but also minimizes the risk of urinary infections. Adopting a routine of voiding every 2 hours might reduce incontinence episodes. Kegel exercises can further enhance sphincter strength. Advising clients to cut down on fluids isn't appropriate. While reduced intake might not directly lead to kidney stones, it's not the main concern here. Using a catheter isn't the first line of action for incontinence post-TURP, and it's unhelpful to use it as a threat. In advanced osteoarthritis, pain is typically described as A. Tiredness paired with pain. B. Pain arises from slight movement. C. Crepitation emerges, amplifying pain. D. Both joints feel pain evenly. Here, option B is the right answer, because in the later phases of osteoarthritis, minimal movement or even resting can lead to pain. Crepitation might be present regardless of the disease stage, but doesn't intensify the pain. The disease doesn't affect joints symmetrically. Features like even joint impact and fatigue are more associated with rheumatoid arthritis. Now, I'd like to quickly test your knowledge. Can you tell me which drug is used to treat iron overload? Please write your answers in the comment box below. And now a patient with toe osteomyelitis shows pain, unstable walk, and fatigue. The nurse should institute which of the following? A. Use airborne safety. B. Rest in bed. C. Take anti-fall measures. D. Recommend physiotherapy. Here, option C is the right answer, because due to toe osteomyelitis, the patient is prone to falls, so the nurse should start anti-fall measures. Airborne safety isn't necessary. There's no sign the patient needs physiotherapy, and encouraging mobility for the patient is crucial. Before we dive into the next question, I've got an opportunity for you to earn passive income by selling our online course. Simply refer our course to your circle. You'll earn a flat 10% commission on every sale you drive. Just imagine, if you help enroll 10 students in a month, you could be raking in thousands of dollars every single month. Want to know more? All the details are available on our website. The link is provided in the description box below. Now, what should the nurse do when encountering a patient in an uncomfortable bed position? A. Give the patient their medications. B. Check the patient's name band. C. Ask the patient their name. D. Adjust the patient's pillow behind their back. Here, option D is correct, because before administering medication, the nurse's initial step is to ensure the client is comfortably positioned. Once the client's immediate needs are addressed, the nurse should then verify the client's identity by inquiring about their name and examining their wristband. Only after these steps should the medication be given. Which patient does the nurse need to discuss immediately with the doctor? A. An individual after knee surgery feeling constipation and stomach pain. B. A person with a recent head injury now showing confusion and vomiting symptoms. C. Someone with leg vasculitis asking for extra painkillers before the bandage change. D. A person who had surgery and has a red mark on their bandage. Option B is correct here. The rationale: if there's a change in consciousness, symptoms like vomiting, worsening headaches, memory shifts, confusions, mood swings, or pupil changes, it's essential to alert the doctor immediately, especially if the patient has had a head injury. After surgery, nurses should encircle the drainage area on the dressing to monitor it. A small dime-sized spot isn't urgent, but should be observed. Post-surgical constipation and stomach discomfort need care but aren't the top priority. While it's essential to secure adequate pain relief to support wound healing, it isn't the immediate concern. A term multigravita's cervix was 5 centimeters dilated, 100% effaced, and at one station 30 minutes ago. Now she's expressing discomfort and a need for a bowel movement. What's the most appropriate nursing action? A. Conduct a new sterile vaginal examination. B. Help her go to the bathroom. C. Alert the primary healthcare provider about her discomfort. D. Explain that her sensation is because of the fetal head's pressure. Option A is correct here. Here's the rationale. The patient might have quickly advanced and could be prepared for delivery. Before assisting her to the bathroom, a sterile vaginal exam is essential to determine full dilation. If she's on the verge of giving birth, the sensation she feels can be attributed to the pressure from the fetal head. If there's no change in her cervical status, pain management may be required. Following the assessment, the nurse should converse with both the patient and the primary healthcare provider about the findings. A 2-year-old with a recent flu and a persistent 3-day fever is admitted to the emergency room following a seizure. Seeking clarity, the father questions the potential reasons. The nurse provides the following explanations. A. It's possible the seizure was a result of the child's yet-to-mature immune defenses. B. Consecutive days of fever might have culminated in the seizure. C. A swift rise in body temperature could be the catalyst of your child's seizure. D. Your child's seizure might have been activated when their fever reached a critical level. Option D is correct here, because febrile seizures typically happen as the temperature rises, linked more to its peak than how quickly or how long it rises. Such seizures in children usually correspond with fevers above 38.8 degrees centigrade. They're most frequently in kids aged 18 months to 3 years, but aren't tied to immune system maturity. The nurse is teaching the spouse of a client who underwent an incision and drainage procedure for an abscess about wound care at home. The nurse should advise the spouse to A. Do cleaning from the drainage site towards the incision site. B. Consider cleaning both sides separately. C. Clean starting from the incision site, moving towards the drainage site. D. Do cleaning of the incision and drainage sites at the same time. Here, option B is right. The rationale. Treat each site independently to prevent cross-contamination. Always clean from the less contaminated to the more contaminated area. Consider every site as a distinct region for wound care. For a patient with anger outbursts, which statement suggests they're prepared for discharge? A. It would help if my mom would stop getting on my case all the time. B. I'll be on medications like valproic acid and propranolol to help me maintain control. C. I won't let anger take over me. D. Alcohol isn't the solution, but I enjoy my time at the bar. Here, option B is right, because valproic acid and propranolol are commonly used to control severe anger episodes. Acknowledging the need for these medications signals a patient's preparedness to be discharged. Expecting to never feel anger is unfeasible without proper anger management techniques. Relying on drinking doesn't tackle the root issue of anger and hints at potential ongoing alcohol abuse. Putting the blame on others, like the client's mother, sidesteps addressing personal anger issues and shows an avoidance of personal responsibility. What should a father do first after his child's arm gets burned? A. Notify the health provider and cover with a cloth. B. Use cool water on the burn and cover with a cloth. C. Apply ice to the arm, then rush to the emergency room. D. Apply antibacterial ointment and contact the doctor. Option B is correct, because for a child's burn, the optimal advice is to first rinse the affected area with cool water to halt the burning progression. Subsequently, encase it in a sterilized cloth. Once done, the primary healthcare provider for the child should be informed. Utilizing ice can potentially exacerbate the injury, as cold can also induce burns similarly to heat. Generally, it's best to refrain from using ointments until a proper assessment of the burn is made. A 28-year-old female is prescribed danazol for endometriosis. What side effects should she report? A. Hair loss. B. Increased libido. C. Weight loss. D. Headaches. Here, option D is the right option, because danazol may cause side effects like migraines, lightheadedness, mood swings, and reduced desire. Masculine features like a lower voice, face hair growth, and increased weight are also potential effects. A patient with type 1 diabetes is set for surgery and has been fasting since midnight. The nurse observes that the morning insulin hasn't been prescribed. What should the nurse prioritize? A. Alert the post-op care team about the missing insulin prescription. B. Administer the standard morning insulin. C. Measure the patient's bedside blood sugar levels. D. Speak with a primary care doctor about insulin instructions. Option C is correct. The rationale is the nurse must reach out to the doctor to determine if the regular insulin dose should be administered pre-surgery, but acquiring the blood glucose reading offers critical data that the doctor might require to finalize the insulin amount. The nurse shouldn't presume the standard dose is suitable. Delaying this decision post-surgery isn't advisable. A new Asian mother in North America with limited English proficiency occasionally bottle feeds her baby. The majority of the care is given by her mother-in-law. What's the nurse's best course of action? A. Secure approval for a post-discharge home visit. B. Find out if it's a tradition within their culture. C. Inform the social worker regarding potential bonding concerns. D. Note the distinct maternal actions in her file. Here, option B is the right answer, because in numerous Asian traditions, the month following a baby's birth is considered a recovery period for the mother. The nurse's primary step should be to understand if this is in line with the client's cultural beliefs. If it aligns, the client is acting within their cultural norms. Education should be extended to both the mother and the mother-in-law. Absence of bonding might only be concerned if the mother seems indifferent towards her baby. It's routine to document maternal behavior, but it shouldn't be presumed as atypical, as it could align with the client's cultural background. A home visit isn't necessary only if there's potential neglect, or if the family requires further assistance or knowledge. Now, it's time to test your knowledge. Tell me, what is the antidote of atropine? Write your answer in the comment box. Before we jump into the next question, I've got exciting news that you don't want to miss. Now, you can also join our exclusive online course. Here's why you should join. You will get daily 2-hour live classes by experts, instant access to all recorded classes covering every nursing topic, dive deep into 2,000 NCLEX questions via 200 meticulous video lectures. Challenge yourself with our test series and mock tests. For this month only, we're giving you a massive 70% discount on the entire course fee. But starting next month, this offer disappears forever. Click on the link in the description box below and give your learning a transformational boost. Now, for a patient who has been administered tissue plasminogen activator, or TPA, or alteplase recombinant treatment, what should the nurse prioritize? A. Give intramuscular injections. B. Extract blood gas samples from the radial artery. C. Promote moderate exercise. D. Apply arterial pressure for 15 seconds. Here, option B is the correct answer, because the nurse is advised to utilize the radial artery for blood gas sample extraction, as it allows for more consistent pressure application compared to the femoral artery. When caring for a patient who has been given TPA or alteplase recombinant treatment, it's essential to sustain arterial pressure for an extended 30 seconds. This is because coagulation takes a prolonged duration due to the presence of the thrombolytic agent. Administering intramuscular injections isn't recommended during thrombolytic treatment. Additionally, the nurse should minimize any physical interventions with the patient to avoid potential bruising. The nurse is instructing a support staff member about the care of patients with self-mutilation. Which response by the support staff about self-mutilation indicates a proper understanding? A. It's a tactic to control others. B. It's an expression of deep-seated emotions and frustration. C. It's a minor issue that doesn't need attention. D. It's a method for the individual to seek attention. Here, option B is the correct answer. Because self-mutilation serves as an outlet for intense emotions like anger and despair, frequently observed in individuals with borderline personality disorder. Often, it represents a desperate plea for assistance, or an expression of profound anger, powerlessness, or remorse. For those feeling disconnected or facing feelings of unreality, self-harm provides tangible pain, reinforcing their existence through the sensation of physical hurt. It's crucial to understand that self-harm isn't a tactic to get one's way or manipulate situations, though it's often misconstrued in this manner. Self-harming actions are grave and pose risks to the individual and must not be overlooked. While conducting standard tracheostomy care, which action should the nurse incorporate? A. Place a sliced gauze pad beneath the neck brace for skin protection. B. Do suction to the inner tube once the process is finished. C. Clean the inner tube at 3-hour intervals. D. Fasten the tracheostomy straps using a square knot. Here, option D is correct. Because during tracheostomy maintenance, it's essential to ensure the tracheostomy straps are fastened properly to avoid the tube becoming dislodged. There's no need to cleanse the inner tube every 2 hours. Typical cleaning intervals are around every 8 hours. Nurses should employ ready-made tracheostomy pads beneath the neck brace to shield the skin near the stoma. Utilizing sliced gauze can lead to stray gauze threads entering the breathing passage. The inner tube should be cleared with suction prior to its cleaning, not post-cleaning. After educating a parent about the infant's evident Babinski's reflex, the nurse can confirm the parent's comprehension when she mentions that a clear Babinski's reflex means A. Underdeveloped central nervous system. B. Potential harm to nerves linked to the legs. C. Potential defect in the lower extremities. D. Possible partial paralysis. Here, option A is correct, because a positive Babinski's reflex in a newborn is a standard observation indicating the underdeveloped nature of the corticospinal pathways in their central nervous system. While a neonat's muscle coordination is still in its developmental stages, the Babinski's reflex isn't a direct measure of this aspect. This reflex doesn't suggest issues with the spinal cord or injuries to the nerves connected to the legs. There is no implication of partial paralysis from this reflex. However, in adults, a positive Babinski's reflex can signal a medical condition. When getting a patient ready for a surgical procedure, the nurse evaluates potential psychological issues that might lead to pre-surgery stress. Which of the following fears is considered to be the most unsettling for a patient about to undergo surgery? A. Worry regarding the impact of anesthesia. B. Dread of experiencing pain. C. Apprehension about the unfamiliar. D. Concern over alterations in physical appearance. Here, option C is correct, because pre-surgery apprehension in a client can stem from various concerns, including the impact of anesthesia, changes in physical appearance due to surgery, being away from loved ones, potential unemployment, incapacitation, pain, or even the possibility of death. Nevertheless, the most profound anxiety is often related to the fear of the unknown, which can render the patient feeling powerless. Consequently, a crucial component of preoperative nursing involves gauging the patient's anxieties and identifying potential triggers. By doing so, emotional reassurance can be provided, ensuring the patient is mentally well prepared for the upcoming procedure. A young individual diagnosed with Hodgkin's disease is back in the hospital due to the aggressive nature of the ailment, which isn't reacting well to various treatments. Death seems likely. A primary focus for this patient should be to A. Lessen apprehensions concerning intensive treatments. B. Diminish the sense of loneliness. C. Overcome sentiments of social insufficiency. D. Alleviate anxiety about potential pain. Here, option B is the correct answer, Because patients with terminal illnesses frequently express feelings of loneliness as they feel overlooked, such patients can detect any unease their loved ones may experience when with them. Care strategies encompass devoting time to the patient, fostering conversations about their emotions, and addressing inquiries with transparency and sincerity. Easing anxieties about pain or intensive treatments comes after addressing the patient's sense of solitude. Diminishing sentiments of social insufficiency isn't directly pertinent to those with terminal conditions. Now it's time for the contest question. What is the drug of choice to treat seizures in pediatric patients? Write your answers in the comment box. Be prepared to win a prize ranging from $500 to $1,000 or you can choose to enroll in our online course for free. Okay, when giving an educational session for a patient on lithium therapy, the nurse should inform the patient about A. Opting for foods marked low sodium. B. Enhancing salt intake in meals. C. Maintaining an adequate sodium intake. D. Eliminating sodium from meals. Here, option C is the correct answer, because the nurse should instruct both the patient on lithium and their family about the significance of ensuring sufficient sodium consumption to avert lithium toxicity. Given that lithium is a salt, a decrease in sodium intake might lead to its prolonged retention and potential toxicity. Boosting dietary sodium isn't advised and could be detrimental. Elevated sodium levels lead to diminished lithium concentrations, which could hinder its therapeutic efficacy. A 32-year-old female presents with fatigue and painful urination. She has a fever of 38 degrees centigrade and sore vesicles around her vaginal region. She mentions to the nurse that she had intercourse with a new partner about a week ago. What should the nurse's response be? A. Advise the client to apply soothing gel to the vesicles. B. Suggest the client request her partner wear a protective barrier during intimacy. C. Guide the client to consult with a medical professional. D. Recommend the client consume up to 4 liters of water daily. Here, the correct answer is C. The rationale is, the client appears to display symptoms consistent with genital herpes. These symptoms can include painful blisters or vesicles that emerge 2 to 20 days post-exposure. It's possible that the client was exposed through her recent partner. It's essential for the client to consult a healthcare professional for appropriate diagnosis and treatment. While measures such as having her partner use a condom, increasing fluid intake, or using lubricant may offer some relief or preventative measures, they will not cure the infection. Before moving to the next question, I want to tell you that you have an opportunity to earn a significant passive income with us. Sell our NCLEX online courses and earn a 10% commission on every sale you make. Imagine this. Just by selling 10 or more courses a month, you can rake in thousands of dollars. And that is just the beginning. Become an affiliate member now and turn your network into a gold mine. Click the link in the description box and get started today. A couple with a Down syndrome newborn informs the nurse they weren't expecting the diagnosis. Which statement suggests they know something about Down syndrome? A. Down syndrome children have a wide range of mental and physical attributes. B. Kids with Down syndrome may be wary of unfamiliar people and struggle with friendships. C. They might show aggression during puberty due to hormonal shifts. D. Down syndrome kids might need institutional care at some stage in their life. Here, option A is the correct answer, because Down syndrome children can exhibit intellectual capabilities ranging from significant disabilities to slightly below average intelligence. Their physical characteristics can include almond-shaped eyes, a petite, flat nose, a small mouth, often with a noticeable tongue, and diminutive ears. It's common for them to have a singular crease on their palm, shorter fingers, and fine straight hair. Socially, they tend to be 2 to 3 years behind their age group. Many might reside in group homes, while others stay with their parents or relatives. Typically, these children are amiable and have a calm disposition. In a critical care unit, 4 patients have a nosocomial infection of Pseudomonas aeruginosa. Choose the best nursing intervention. A. Ensure staff don't have artificial nails. B. Use an N95 mask for patient care. C. Start contact precautions. D. Begin transmission-based precautions. Here, option A is the correct answer, because research confirms that bacteria residing under the nails can be transferred to others, even with thorough hand washing. As such, staff on this unit should avoid artificial fingernails, which may be a potential source of infection. Guidelines from the Centers of Disease Control and Prevention, World Health Organization, Public Health Agency of Canada, and endorsements from the Joint Commission and Health Canada emphasize proper hand hygiene to prevent infections. There's no requirement for transmission-based or contact precautions in this scenario, and wearing a mask for these clients isn't necessary. A patient is prescribed isosorbate dinitrate for angina relief. Which statement signifies that the patient is aware of the medication's potential side effects? A. It's important that I notify my doctor if I notice my ankle swelling. B. When changing postures, I must do so gradually to prevent dizziness. C. Before administering the medication, I should check my pulse. D. I should consume isosorbate dinitrate alongside a meal. Here, option B is correct, because isosorbide often results in side effects such as dizziness, a feeling of lightheadedness, and a drop in blood pressure upon standing. To mitigate these effects and avert potential fainting episodes, patients should be advised to transition between positions in a gradual manner. Swelling of the ankles isn't a consequence of isosorbide use. There's no necessity for the patient to measure their pulse before medication intake or to pair the medication with food. Allopurinol is given to a patient with long-term gout. Which statement shows that the patient knows how to consume allopurinol? A. I shouldn't consume aspirin while I'm taking allopurinol. B. I'll use the medication whenever I feel pain in my joints. C. It's best for me to take this medication without food. D. Drinking a lot of water is essential when I'm on allopurinol. Here, option D is correct, because for clients taking allopurinol, it's crucial to increase fluid intake to around 3,000 milliliters per day. This helps prevent kidney stone formation. To effectively manage gout, allopurinol needs to be taken consistently. It's advised to consume the medication post-meals to minimize the risk of stomach upsetness. While it's possible to combine aspirin and allopurinol, both can irritate the stomach. Hence, it's not advisable, especially for those sensitive to these drugs. A female patient is using oral birth control pills. The nurse informs her that which of the following medications might reduce the effectiveness of her contraceptives? A. Diuretics. B. Antihypertensives. C. Antihistamines. D. Antibiotics. Here, option D is right, because broad-spectrum antibiotics may reduce the effectiveness of oral birth control pills, potentially increasing the risk of unintended pregnancy. While undergoing antibiotic treatment, it's advisable for the individual to use an alternative contraceptive method. Meanwhile, antihypertensives, diuretics, and antihistamines don't impact the performance of oral contraceptives. In the suction control chamber of a chest drainage system, if you observe gentle bubbling, is it normal or abnormal? Write your answers in the comment box, and be ready to win a prize of $500 to $1,000. Or you can enroll in our online course for free. Which among the following is associated with an increased risk of toxic shock syndrome, TSS? A. Alternating tampons with sanitary pads. B. Using only tampons at night. C. changing tampons every 2 hours. D. Avoiding use of deodorized tampons. Here, option B is the correct answer. Toxic shock syndrome, TSS risk, can increase when tampons are used overnight, typically remaining in place between 7 to 9 hours. While toxic shock syndrome can manifest under various circumstances, it's notably linked with menstruating women, especially those who prefer tampons. The risk escalates with prolonged tampon use. To mitigate this risk, it's advised to change tampons at least every 3 hours, abstaining from deodorized tampons, and rotate between tampons and sanitary pads. A computer operator is diagnosed with carpal tunnel syndrome. Which of the following is a primary cause? A. Muscle wasting from inactivity. B. Continuous wrist bending. C. Compression of the median nerve. D. Reduced blood flow to the brachial nerve. Here, option C is correct, because carpal tunnel syndrome arises from the compression of the median nerve within the wrist's confines. The condition doesn't involve the brachial nerve. While systematic diseases like rheumatoid arthritis or diabetes mellitus can contribute to its onset, repeated hand motions, often seen in certain occupations, can also be a trigger. Contrary to some misconceptions, it doesn't stem from inactivity, nor does it cause the wrists to form flexion contractures. A person is diagnosed with cystitis. Which of the following should the nurse evaluate the patient for? A. Nausea and vomiting. B. Foul-smelling urine. C. Oliguria. D. Flank pain. Here, option B is right, because urine with an unpleasant odor can suggest cystitis. Accompanying signs might be burning during urination and increased frequency and urgency of urination. Symptoms such as flank pain, nausea, and vomiting are more associated with pyelonephritis. Once a child has been transferred from the post-anesthesia care unit after surgery, which assessment should the nurse prioritize? A. The functioning of the nasogastric tube. B. The IV fluid access site. C. The child's level of pain. D. The surgical site dressing. Here, option D is the correct answer, because following surgery, the nurse first evaluates the dressing over the surgical site to check for any signs of bleeding or discharge. After this primary assessment, the nurse then proceeds to examine other aspects, like the condition of the IV insertion point, the patient's pain level, and the functionality of the nasogastric tube. A patient displays initial signs of alcohol withdrawal. Their heart rate is 110 BPM, and their blood pressure stands at 165 over 95 mmHg. The nurse's appropriate step would be to A. Use limb restraints. B. Inform the primary healthcare provider. C. Designate a non-licensed personnel to accompany the patient. D. Provide lorazepam. Here, option D is the correct answer, because lorazepam, which belongs to the benzodiazepine class, is frequently prescribed to alleviate central nervous system hyperactivity in patients showing initial signs of alcohol withdrawal. At this juncture, there's no clear evidence suggesting the need for restraints. If lorazepam proves effective, there may be no requirement for constant companionship for the patient. Currently, there's no immediate need to alert the physician. During the second stage of labor, a patient hasn't received any anesthesia or analgesia. Which position should the nurse help the patient assume to facilitate pushing? A. In the knee-chest position while keeping the head down. B. Squatting with the back arched. C. Side-lying while keeping the head elevated. D. Squatting with the body curved in a C shape. Here, option D is correct, because anatomically, adopting a squatting stance widens the pelvic exit, leveraging the pull of gravity during the pushing phase. For optimal effectiveness, the mother should mold her body into a semicircular or C shape. Now here's your contest question. If a nurse has to nebulize a patient with both ipratropium and budesonide at the same time, which one should be given first for nebulization? Write your answers in the comment box. For a patient with a spinal cord injury using a wheelchair, which guidance should a nurse provide to lower the chances of pressure sore development? A. Engage in daily cleansing. B. Prioritize a carbohydrate-intensive meal plan. C. Reposition oneself by adjusting weight every 15 minutes. D. Transition between the wheelchair and bed every couple of hours. Here, option C is correct. A patient confined to a wheelchair due to a spinal cord injury should be educated on the importance of making subtle weight adjustments, elevating the sacral region approximately every quarter hour. This practice aren't recommended since prolonged bed rest isn't advisable. Notably, pressure ulcers can form in under 2 hours. A child with moderate diarrhea needs management advice. Which option should the nurse suggest? A. Maintain the child's usual dietary intake.
NClex coaching.
B. Give the child foods like bananas, rice, applesauce, and toast. C. Provide the child with clear liquids for a day. D. Suggest foods that have minimal fat content. Here, option A is correct, because for children with mild to moderate diarrhea, current guidelines advise maintaining the child's usual dietary habits. Adhering to this diet seems to expedite recovery. Clear beverages like juices, sodas, and gelatin are rich in carbohydrates but have a low electrolyte content, much like foods including bananas, rice, applesauce, and toast. Low-fat foods generally also have insufficient electrolyte content for the child's needs. When administering a nasogastric tube feeding to a client, the nurse should A. Confirm the correct placement of the tube before initiating the feeding. B. Ensure the feeding solution is at a warm temperature prior to use. C. Draw out any remaining stomach contents before introducing the feed and dispose of them. D. Position the client on their left side. Here, choice A is correct, because before initiating the feed, it's essential to confirm the tube's placement. Contrary to warming the solution, it's advised against, as it might promote bacterial proliferation. For the feeding process, ensure the client is either reclined with an elevated head or in an upright seated position. When checking for gastric residuals, it's best to aspirate and then reinsert them to avert potential electrolyte imbalances. Which method is appropriate for giving a subcutaneous injection? A. Inserting the needle at a 45-degree angle to the surface of the skin. B. Drawing up 0.3 milliliters of air into the syringe prior to administering. C. Using a 1-inch or 2.5 centimeter needle for the injection. D. Holding the skin taut at the injection spot. Here, option A is right, because subcutaneous injections are delivered into the layer of fat between the skin and the muscle. The angle of insertion can vary between 45 to 90 degrees, depending on the physical constitution of the patient. Needles chosen for this method of administration typically range from 3/8 to 5/8 inches in length. To ensure the injection reaches the intended subcutaneous layer, it's advisable to gently pinch the skin at the designated site, lifting the fatty tissue. Contrary to some methods of injection, there's no requirement to introduce air into the syringe when setting up a subcutaneous injection. A patient undergoing a bronchoscopy with biopsy due to suspected lung cancer requires post-procedure care. The nurse's responsibilities include A. Ask the patient to refrain from speaking until the gag reflex is fully restored. B. Providing pain relief medication as required to treat discomfort. C. Suggesting the patient to rinse with oral lidocaine to alleviate throat discomfort. D. Observing the patient for signs of pneumothorax. Here, option D is the correct answer, because following a bronchoscopy with biopsy, it's essential for the nurse to observe the patient for indications of both pneumothorax and bleeding. The patient should refrain from using oral lidocaine as it might delay the return of the gag reflex. Post-bronchoscopy mediastinal discomfort isn't typical, but if experienced, it should be immediately communicated to the doctor. There's no need to advise the patient against speaking due to concerns about the gag reflex. A child is receiving antibiotic therapy due to a urinary tract infection. Which of the following symptoms should prompt the parents to inform the nurse? A. Appetite decline. B. Elevated body temperature. C. Yellowing of the skin or eyes, jaundice. D. Increased urine output. Here, option B is correct, because the nurse should recommend that parents immediately report any rise in the child's fever, as this could suggest that the infection isn't subsiding. While an uptick in urine production might be observed, gauging this accurately can be challenging for parents, and it isn't a primary symptom of a worsening infection. A diminished appetite could stem from the infection itself or the medication side effects, but doesn't necessarily signify a deteriorating condition. Jaundice isn't a typical result of a treated urinary tract infection in a child. Here's the next question for the contest. What is the onset of glargine insulin? Write your answer in the comment box. After getting injured in a car accident, a baby needs to have a splint on the affected leg. The father observes that the baby is still active even with the splint on. What advice should the nurse give to the mother? A. Ensure the surroundings where the baby moves are free from potential hazards. B. Only put the splint on the baby during nighttime, taking it off in the daytime. C. Contact the doctor right away to reconsider the treatment approach. D. Restrict the baby to a single room in the house. Here, option A is correct, because safety is paramount when looking after this infant. Infants are remarkably adaptable, and their mobility can increase even when they're wearing a splint. As a result, it's essential for the father to make certain that the environment where the infant moves is devoid of hazards. There's no immediate requirement to reach out to the doctor to modify the treatment strategy. Limiting the infant to a single room might hinder their natural developmental progress. For wholesome growth, the child benefits from varied surroundings. It's crucial for the infant to wear the splint as directed by the doctor to guarantee the best healing outcome. When providing post-surgery care guidelines for a newborn who underwent correction for tracheoesophageal fistula, TEF, the nurse educates the parents about the potential long-term healthcare concerns. Which of the following is a highly probable condition their child might develop? A. Speech difficulties. B. Recurring moderate dehydration due to mild diarrhea. C. Ulcer formations. D. Esophageal narrowing or stricture. Here, option D is the correct answer, because dilation at the junction site is often required during the early years for approximately half of the children who undergo corrective surgery for TEF. The surgery doesn't typically lead to recurrent mild diarrhea paired with dehydration. While speech issues might arise due to other concurrent abnormalities, TEF itself doesn't impact the larynx or speech structures. Difficulty swallowing and strictures can reduce food consumption, leading to potential weight gain challenges. However, gastric ulcers are not a direct result of TEF repair surgery.